There are two problems with the way we manage hypothyroidism currently. The first and biggest problem is that we're told to use the TSH to both diagnose and treat hypothyroidism. In other words, the goal of therapy for the last 50 years has been to obtain a TSH value between a certain range of numbers. The problem with this is that the TSH is a blood test that measures the amount of the thyroid hormone that's seen by our pituitary gland. The problem with that is that just because we're measuring the amount of the hormone doesn't mean that we're actually measuring whether it's working or not. A perfect example of that would be in the case of diabetes, where we have insulin resistance. In that situation, we know better than to manage patients by measuring the amount of the hormone, which is insulin. Rather than measure the amount of the hormone, we measure what it does, which is blood sugar. So in order to take care of a diabetic, we give enough insulin to make sure that the blood sugar is normal. Interestingly, most diabetics start out with an abundance of insulin to begin with, but due to the insulin resistance, it just simply doesn't work. So it's clear that if we manage diabetics the way we manage hypothyroid patients, we'd have a lot of sick diabetic patients, like we do thyroid patients currently. The other problem is that our endocrine organizations, such as the Endocrine Association and the Royal College of Thyroid Specialists in the UK, insist that the TSH be our goal for the management of hypothyroid patients. I'm not sure what motivates them to cling to this idea that the TSH is the proper way to manage thyroid, but for whatever reason they do. I've asked a number of them how they know that the TSH measures thyroid function, and I have yet to receive any sort of decent answer to that question. So as long as we allow the endocrinologists to continue to bully us into believing that the TSH is the way that we should manage thyroid patients, we will continue to not take care of our patients very well. What we need to do is focus on clinical outcome, which would be some way of measuring metabolism. Since we don't have a blood test that measures metabolism, what we need to do is go back to the way of assessing metabolism clinically by asking patients about their energy level, their temperature, their skin texture, etc. Until we have a blood test that directly measures metabolic rate, we really should not be managing hypothyroidism by blood test values at all.